Hey guys, tonight on Margaret Radio Health in Later Life, we're going to talk about something that many of us, as we gracefully navigate the chapters of later life, might find a little too familiar, that gentle, or sometimes not so gentle, nudge from our knees. We're specifically going to explore the quiet question that often accompanies a persistent ache or a new twinge. When is this knee pain something to simply manage with a warm compress and a bit of rest, and when is it a signal from your body that it's time to have a chat with your doctor? Imagine you're settling into your favorite armchair, perhaps with a warm cup of herbal tea, the day winding down, the house quiet. It's in these moments of stillness, isn't it, that we often become more aware of our bodies, the subtle creaks, the gentle reminders of all the steps we've taken, the paths we've walked. And sometimes, one of those reminders comes from a knee, maybe a dull throb as you stand up, or a sharp little protest when you climb the stairs. It's a common experience, this knee-related symphony of sensations, and it's perfectly natural to wonder what it all means. We're not aiming for a clinical discussion tonight, not the kind that makes you feel like you need a medical dictionary just to keep up. Instead, think of this as a gentle fireside chat, a soft exploration of a topic that touches many lives. We'll be looking at knee pain through a lens of understanding and reassurance, helping you become a more informed observer of your own body's signals. Sometimes, the biggest worry comes from the not knowing, that little loop of what if that can play in our minds, especially when everything else is quiet. It's funny, isn't it, how a tiny ache can sometimes feel determined to audition for a leading role in our thoughts, especially if we've perhaps spent a little too much time with the internet late at night, where every sniffle can seem like a symphony of disaster. Tonight, we're aiming for the opposite, to bring a sense of calm and clarity. Our knees, these incredible marvels of engineering, carry us through so much. They bend, they flex, they support us as we dance at weddings, kneel in the garden, or simply walk to the corner shop for the morning paper. So, when they start to communicate a little more insistently, it's wise to listen, but not necessarily with alarm. This evening, we'll gently unpack some of the reasons why your knees might be feeling a bit more vocal these days, and more importantly, we'll discuss those subtle and not so subtle signs that suggest a professional conversation might be beneficial. It's about empowering you with information, so you feel more confident in knowing how to care for yourself. So, before you get comfortable, take a moment to like the video and subscribe, but only if you genuinely enjoy what I do here. Your support, even a simple click, truly does make a difference and helps others find this little sanctuary of calm information. And as you're doing that, I'd love to know where you're tuning in from tonight. It's always so wonderful to see our community stretching across different corners of the world. Go ahead and post your current location and your local time in the comments below. It helps me feel connected to all of you, picturing you settling in, wherever you may be. Now, dim the lights, maybe turn on a fan for that soft background hum, and let's ease into tonight's journey together. Let the day's concerns drift away like clouds on a gentle breeze. We're going to move through this topic with care and understanding, focusing on what you can know, and what you can do, to feel more at peace with the signals your body sends. There's no rush, just a slow, steady exploration, designed to be as soothing as it is informative. We're starting this conversation from a place of quiet curiosity, wondering about the stories our knees might be trying to tell us, and how we can best listen and respond with gentle wisdom, especially as the years gift us with more experience, and perhaps, a few more of these bodily conversations. So, as you settle deeper into your comfort, perhaps feeling that gentle hum of the fan or the quiet of your room, let's softly begin to explore some of the reasons why your knee, or perhaps both knees, might be asking for a little more attention these days. It's like trying to understand a language your body speaks. Sometimes the messages are whispered, and other times they're a bit more insistent. Many people find themselves wondering, is this ache just a sign of the years passing, or is there a specific story my knee is trying to tell? The truth is, your experience is unique, but there are common narratives when it comes to knee discomfort in later life, and understanding these can be the first step towards feeling more at ease and in control. One of the most familiar reasons for knee pain, especially as we gather more birthdays, is something called osteoarthritis, often referred to as wear and tear arthritis. Now, that phrase wear and tear can sound a bit disheartening, as if our joints are simply wearing out like an old coat. But perhaps a gentler way to think of it is as the result of a lifetime of movement, of supporting you through countless experiences. Your knee joint is a marvel, with smooth, slippery tissue called cartilage acting as a precious cushion between the bones, the end of your thigh bone, the top of your shin bone, and the kneecap itself. This cartilage allows your bones to glide over each other almost frictionlessly when you bend your leg to sit down, or straighten it to take a step. It's a truly remarkable substance, resilient and strong. However, over many, many years, and through countless movements, this cartilage can gradually begin to thin, or its smooth surface can become a little rougher. Imagine a well-loved pathway in a beautiful old garden. With time and many footsteps, the stones might become a little uneven. It doesn't mean the garden is any less beautiful, but the path might require a little more mindful navigation. When this cushioning cartilage changes in the knee, the bones may not glide as smoothly, and this can lead to sensations of stiffness, perhaps particularly noticeable when you first wake up in the morning or after you've been sitting still for a while, maybe reading a good book or watching a favorite program. You might find that the knee feels a bit stiff and reluctant to get going, but then, as you gently start to move, it gradually eases up. This pattern of stiffness, often followed by a dull ache or a deeper pain that tends to worsen with activity, like a long walk, climbing stairs, or kneeling to tend to your plants, and then feels better with rest, is quite characteristic of osteoarthritis. It's a well-established health fact that osteoarthritis is the most common type of arthritis affecting adults, particularly as they enter their later years, and the knee is one of the most frequently involved joints. The discomfort from osteoarthritis can vary greatly from person to person. For some, it might be a mild, intermittent ache that comes and goes, perhaps more noticeable on damp, cold days, a phenomenon many people report, though the exact science of why weather affects joint pain is still something researchers are exploring. For others, the pain can become more persistent and intense, sometimes making it a little challenging to enjoy activities you once did without a second thought. You might also notice a grating or scraping sensation when you move your knee, a sound sometimes called crepitus. While this sound can be a bit unnerving, it's often just the roughened cartilage surfaces moving against each other and isn't always a direct indicator of how much discomfort you're experiencing. Some people have quite noisy knees with little pain, while others have quieter knees that ache more. It truly is a very individual experience. The joint might also appear a little swollen at times, especially after overdoing it a bit. This swelling is often due to an increase in joint fluid, the body's natural response to irritation within the joint. It's important to remember that osteoarthritis isn't just about cartilage. The entire joint can be affected. The underlying bone can change, ligaments can thicken, and the muscles around the knee might weaken if pain causes you to move less. It becomes a bit of a cycle, sometimes. But understanding that this is a gradual process, often unfolding over years, can take away some of the fear. It's not something that typically appears overnight with great drama, but rather a slow conversation your body is having with you. Now, while osteoarthritis is very common, it's not the only reason your knees might be feeling tender. Another category to be aware of, though typically presenting differently, is inflammatory arthritis. Rheumatoid arthritis is perhaps the best-known example in this group. Unlike osteoarthritis, which is primarily due to mechanical wear and changes over time, rheumatoid arthritis is an autoimmune condition. This means that the body's own immune system, which is designed to fight off infections, mistakenly starts to attack the linings of the joints. This attack causes inflammation, leading to pain, significant swelling, warmth, and redness in the affected joints. If you're experiencing knee pain due to rheumatoid arthritis, you might notice that the pain and stiffness are often worse in the morning, sometimes lasting for an hour or more after waking, and it can also be accompanied by fatigue and a general feeling of being unwell. Another key difference is that rheumatoid arthritis often affects joints symmetrically, so, if one knee is involved, the other one often is too. It can also affect many other joints in the body, like those in the hands, wrists, and feet. The onset can sometimes be more sudden than that of osteoarthritis. While less common than osteoarthritis overall, it's a significant cause of knee pain and requires a very different approach to management, often involving specific medications to calm down the immune system's response. So, if your knee pain comes with a lot of warmth, persistent swelling, and affects other joints symmetrically, especially with prolonged morning stiffness, these are signals that point towards a different kind of conversation with your doctor. Moving away from arthritis, There are other structures around your knee that can also be sources of discomfort. Your knee joint is surrounded by small, fluid-filled sacs called bursae. Think of them as tiny cushions or gliding pads, strategically placed between bones and tendons, or skin and bones, to reduce friction and allow smooth movement. There are several of these bursae around your knee, such as the one over your kneecap, prepatellar bursa, or on the inner side of your knee below the joint, pes anserine bursa. If one of these bursae becomes inflamed, usually due to repetitive pressure, overuse, or sometimes a direct knock, it's called bursitis. Knee bursitis can cause a very specific, localized pain. You might find that a ENGB, female ENGB sonioneural, English, United Kingdom, particular spot on your knee is very tender to the touch, and it might look swollen and feel a bit boggy or warm. The pain from bursitis often worsens with movements that compress or irritate that specific bursa. For example, if you have bursitis over your kneecap, kneeling down can be quite painful. If it's the pes anserine bursa on the inner knee, activities like climbing stairs or even pressure from bedsheets at night might aggravate it. Sometimes, people wonder if this very specific, almost superficial feeling pain is serious, and while bursitis can be very uncomfortable, it's often managed quite effectively once identified. It's a good reminder that not all knee pain originates deep within the joint itself. Sometimes the surrounding tissues are calling for attention. Similarly, tendons around your knee can also become a source of pain. Tendons are tough, fibrous cords that connect your muscles to your bones. When you contract a muscle, it pulls on the tendon, which in turn moves the bone. Just like bursae, tendons can become inflamed or irritated, a condition known as tendinitis. This often happens due to repetitive strain or a sudden increase in an activity that your knee isn't quite prepared for. Perhaps you decided to take up a new, more vigorous walking routine, or spent a whole weekend gardening after a quiet winter. The most common type of tendinitis around the knee involves the patellar tendon, which connects your kneecap, patella, to your shin bone. This is sometimes called jumper's knee, but it can affect anyone, not just athletes. You might feel pain just below your kneecap, especially when you're straightening your leg against resistance, going up or down stairs, or even just after sitting for a long time with your knee bent. Another area could be the quadriceps tendon, which connects the large thigh muscles to the top of the kneecap, causing pain above the kneecap. Like bursitis, the pain from tendinitis is often quite localized, and you might notice it's particularly aggravated by specific movements that use that tendon. It's your body's way of saying, this particular cable is under a bit too much strain right now. Many people find that tendinitis pain has a warm-up phenomenon, where it might be sore at the start of an activity, ease off during, and then return afterwards, sometimes more intensely. Then there's the meniscus. Inside your knee joint, between the thigh bone, femur, and the shin bone, tibia, you have two C-shaped pieces of tough, rubbery cartilage called menisci, plural of meniscus. These act like shock absorbers, helping to distribute weight evenly across the knee joint and providing stability. They are crucial for the smooth functioning of your knee. As we get older, the menisci, like other cartilage in the body, can lose some of their elasticity and water content, making them a bit more susceptible to damage. A meniscus tear can happen with a sudden twisting injury, perhaps if you stumble and your foot stays planted while your body turns. However, in later life, meniscus tears can also occur more gradually, sometimes with minimal or no specific injury recalled. These are often called degenerative tears, and they can happen because the meniscus tissue has weakened over time. If you have a meniscus tear, you might experience pain, stiffness, and swelling in your knee. Sometimes, a distinct symptom is a catching, locking, or clicking sensation in the knee. You might feel like your knee is giving way or is unstable. The pain can be intermittent or constant, and often it's felt along the joint line, either on the inner, medial, or outer, lateral, side of the knee, depending on which meniscus is torn and where the tear is located. Many people describe a sharp pain when they twist or squat. Understanding that these shock absorbers can develop issues, sometimes quite subtly, is another piece of the knee pain puzzle. Ligament injuries, such as a sprain or tear of the anterior cruciate ligament, ACL, or medial collateral ligament, MCL, are often associated with sports and younger individuals, but they can certainly happen at any age, often as a result of a fall, a direct blow to the knee, or a sudden twisting motion. Ligaments are like strong ropes that connect bones to other bones, providing stability to the joint. If a ligament is stretched or torn, it can cause significant pain, immediate swelling, and a feeling of instability, as if your knee might buckle or give out from under you. While perhaps less common as a chronic, ongoing cause of knee pain in the way osteoarthritis is, a past ligament injury that wasn't fully rehabilitated can sometimes contribute to ongoing instability or lead to earlier onset of arthritic changes in the knee. So, if you recall a specific incident that triggered your knee pain, especially if it involved a popping sound or immediate difficulty bearing weight, a ligament issue might be part of the story. Another cause of sudden and quite severe knee pain can be gout or pseudogout. These are types of arthritis caused by the formation of tiny crystals in the joint fluid and joint lining. With gout, the crystals are made of uric acid, a waste product normally filtered out by the kidneys. If your body produces too much uric acid, or your kidneys don't excrete enough, it can build up and form these needle-like crystals. With pseudogout, also known as calcium pyrophosphate deposition or CPPD, the crystals are made of calcium pyrophosphate. An attack of gout or pseudogout in the knee can come on very rapidly, often overnight. You might wake up with intense pain, significant swelling, redness, and warmth in your knee. The knee can be so tender that even the weight of a bedsheet feels unbearable. While the big toe is the most classic site for a gout attack, the knee is also a common target. These conditions can cause quite dramatic episodes of pain, but between attacks, the knee might feel relatively normal. Certain foods, alcohol, or medications can sometimes trigger gout attacks in susceptible individuals. If your knee pain appears with this kind of sudden, intense, and inflammatory picture, it's a very clear signal to seek medical advice, as there are effective treatments to manage these conditions and prevent future attacks. Now, here's a practical and sometimes lesser-known tip or insight. Not all pain felt in the knee actually originates from the knee itself. This is called referred pain. Your body has an intricate network of nerves, and sometimes pain signals from one area can be misinterpreted by the brain as coming from another. For instance, a problem in your hip, such as hip osteoarthritis, or an issue in your lower back, like a pinched nerve, sciatica, for example, can sometimes send pain signals that you feel primarily in your knee. You might be focusing all your attention and remedies on your knee, when the true source of the discomfort lies elsewhere. This is something your doctor can help to assess by examining not just your knee, but also your hips and spine, and by understanding the full pattern of your symptoms. It can be quite a relief, in a way, to discover that your knee itself isn't the main problem, as treatment can then be directed to the correct area. Many people wonder why their knee hurts when all the knee tests seem fine, and referred pain is often a key consideration in such cases. The story of your past also plays a role. If you've had previous knee injuries, perhaps a significant fall, a sports injury from your younger days, or even knee surgery for any reason, these past events can sometimes set the stage for future knee pain or the earlier development of conditions like osteoarthritis. The knee joint might have sustained some damage that, while it healed at the time, altered the mechanics of the joint slightly, making it more vulnerable to wear or discomfort down the line. It's like a beautifully repaired piece of pottery. It's still strong and functional, but the mended area might always be a little different from the original. So, when reflecting on your knee pain, it's worth gently recalling any significant past history related to that knee. Lifestyle factors also weave into this narrative, and it's important to approach this with self-compassion, not blame. Your body weight, for example, does play a role in the health of your weight-bearing joints like the knees. For every extra pound of body weight, your knees experience several extra pounds of pressure when you're walking, and even more when you're climbing stairs or squatting. Over time, this increased load can accelerate the wear on the cartilage and strain the supporting structures. Even a modest amount of weight loss, if you are carrying extra weight, can significantly reduce the stress on your knees and often leads to a noticeable improvement in pain and function. This isn't about achieving a certain number on a scale, but rather about finding a healthy, comfortable weight for your body that allows your joints to function with less burden. Your activity levels are another important thread in this story. It might seem counterintuitive, but both too little activity and too much, or the wrong kind of, activity can contribute to knee pain. If you are very sedentary, the muscles around your knee, particularly your quadriceps, front of thigh, and hamstrings, back of thigh, can become weak. These muscles act like vital support structures for your knee joint. When they are weak, more stress is transferred directly to the joint itself, potentially leading to pain or making existing conditions feel worse. Strong, flexible muscles help to absorb shock and stabilize the knee. On the other hand, suddenly increasing your activity level too much, too soon, or engaging in high-impact activities that your knees aren't conditioned for, can lead to overuse injuries like tendinitis, bursitis, or flare-ups of arthritis. It's all about finding that gentle balance, consistent, moderate activity that keeps your muscles strong and your joints mobile, without overloading them. Many people ask, should I rest my knee completely, or should I try to keep moving? And the answer, as we'll explore more later, often lies somewhere in between, with the right kind of movement being key. Muscle imbalances can also contribute. For instance, if your quadriceps muscles are very strong but your hamstrings are relatively weak or tight, it can create an imbalance in the forces acting across your knee joint. Similarly, weakness in your hip muscles, particularly the gluteus medius, a muscle on the side of your hip, can affect how your leg aligns when you walk or stand, potentially putting extra strain on your knee. These are often subtle factors, not immediately obvious, but they can play a significant role in the development or persistence of knee pain. It's like ensuring all the support ropes on a tent are evenly tensioned. If some are too tight and others too loose, the structure isn't as stable as it could be. Sometimes, even factors like your footwear can have a surprising impact on your knees. Shoes that don't provide adequate support, or that alter the natural alignment of your foot and leg, like very high heels or completely flat, unsupportive shoes, can change the way forces are transmitted up your leg to your knee with every step you take. Over time, this can contribute to strain and discomfort. Simply paying attention to wearing comfortable, well-cushioning, and supportive shoes can be a small but meaningful act of kindness towards your knees. It's also worth gently considering if there are any patterns to your knee pain related to specific activities or times of day. Does it bother you most when you're going upstairs, or down? Is it worse after sitting with your knees bent for a long time, perhaps in a car or at the cinema? Does it wake you at night? Keeping a mental note, or even jotting down these observations, can provide valuable clues. For example, pain when going downstairs often points to issues with the kneecap or patellofemoral joint. Pain that wakes you from sleep can sometimes be a sign of more significant inflammation or a more advanced condition. These details aren't for self-diagnosis, of course, but they help to paint a fuller picture, a story that you can then share if you do decide to consult with a healthcare professional. And finally, there's that overarching question many people have: is this just part of getting older? It's true that our bodies change as we age. Tissues may become less elastic, cartilage may thin, and healing processes might take a little longer. These are natural aspects of the aging journey. However, it's a misconception to assume that significant or limiting knee pain is an inevitable and untreatable consequence of aging. While the likelihood of experiencing some knee discomfort increases with age due to conditions like osteoarthritis becoming more prevalent, debilitating pain is not something you simply have to accept. There are usually specific reasons for the pain, as we've been exploring, and understanding these reasons is the first step towards finding ways to manage it, maintain your mobility, and continue enjoying your life. Attributing all aches and pains solely to getting older can sometimes prevent people from seeking help for conditions that could be effectively managed or improved. So you see, the reasons behind knee pain in later life are varied, like different paths leading to a similar destination of discomfort. It could be the gradual wear of osteoarthritis, an inflammatory condition like rheumatoid arthritis, irritation of the bursae or tendons, a tear in the meniscus, a referred pain from your hip or back, or a combination of these factors, perhaps influenced by your past history and lifestyle. Each possibility tells a slightly different story about what's happening within and around your knee. The key isn't to become an expert diagnostician overnight from this gentle chat, but rather to become more attuned to the signals your body is sending, to recognize that these signals have meaning, and to feel a little more informed about the possibilities. This understanding can transform a vague worry into a more focused awareness, which is a much more peaceful place to be. This journey of understanding the whys behind your knee pain is like carefully turning the pages of a storybook, each page revealing a little more about the characters and the setting. We've talked about some of the main characters like osteoarthritis, and those sudden visitors like gout. But let's delve a little deeper into some of the supporting roles and the subtle influences that also shape your knee's experience, because often, it's a combination of factors working together. You might have noticed that your knee feels different from one day to the next, and it's quite common to wonder what makes some days good and others more challenging. These subtle influences can often hold clues. Let's revisit those important muscles we touched upon earlier, the ones that act as your knee's personal support system. Think of your quadriceps, those large muscles at the front of your thigh. They aren't just one big muscle, they're a group, and one part in particular, the vastus medialis obliquus or VMO, plays a crucial role in keeping your kneecap tracking smoothly in its groove. If this specific part of the muscle is a little weak or not firing at the right time, your kneecap might not glide as happily, leading to discomfort, especially when you bend and straighten your knee. Similarly, your hamstrings at the back of your thigh, and your calf muscles too, need to have a good balance of strength and flexibility. If your hamstrings are very tight, for instance, they can pull on your shin bone and change the pressures within your knee joint. And let's not forget the muscles around your hips, particularly the gluteal muscles, your buttocks. These are powerhouse muscles that control how your entire leg aligns, right from your hip down to your foot, with every step you take. Weakness here, especially in the gluteus medius on the side of your hip, can cause your knee to drift inwards when you walk or climb stairs, putting a little extra twisting stress on the joint over time. It's like the alignment of a car's tires. If one is off, it can cause uneven wear and strain on other parts. Many people are surprised to learn that exercises for their hips can actually be incredibly beneficial for their knee pain. This understanding that everything is connected is often a comforting piece of the puzzle, as it offers more avenues for potential improvement. This idea of connection brings us to think about your overall posture. It might seem a long way from your head to your knees, but how you hold your body throughout the day, whether you tend to slouch when you sit, or stand with your weight shifted more to one side, can gradually influence the forces that travel down through your hips and into your knees. If your posture leads to a slight forward tilt of your pelvis, for example, it can change the way your thigh bone meets your shin bone, subtly altering the load on your knee joint over thousands of steps each day. It's usually not a dramatic, immediate cause of pain, but more like a slow, dripping tap that, over years, can contribute to the wear and tear process or exacerbate existing sensitivities. Gently becoming aware of your posture, and making small adjustments towards a more balanced alignment, can be an act of kindness not just for your back, but for your knees too. This is one of those less obvious factors that people don't always connect to knee discomfort, but it's part of that whole body picture. We also touched on repetitive stress. Think about your life's work, your hobbies, the activities you've engaged in for many years. If your occupation involved a lot of kneeling, squatting, heavy lifting, or climbing stairs, perhaps you were a gardener, a builder, a cleaner, or a nurse, those repetitive motions, day after day, year after year, can place considerable cumulative stress on your knee joints. Even hobbies that you love, if they involve repetitive impact or particular knee positions, like certain forms of dance or long-distance running without adequate conditioning or rest, can contribute. It's not about regretting those activities, as they've often been a source of livelihood or joy, but acknowledging that this long-term patterning of movement can be a factor in the current state of your knee health. It's another layer to the story your knee is telling. Now, let's gently consider something as fundamental as what you eat and drink. While diet isn't typically a direct cause of mechanical knee pain in the way an injury is, your nutritional choices can certainly influence the environment within your body, particularly when it comes to inflammation. We know that conditions like osteoarthritis have an inflammatory component. Some foods, particularly those that are highly processed, rich in sugar, or contain unhealthy fats, are thought to promote inflammation in the body. Conversely, a diet rich in whole foods, plenty of colorful fruits and vegetables, oily fish with omega-3 fatty acids, nuts, seeds, and whole grains, can have an anti-inflammatory effect. This doesn't mean that eating a certain way will magically cure knee pain, but it can be a supportive measure, helping to calm down underlying inflammation and potentially making your symptoms feel less intense or frequent. Think of it as creating a more soothing internal environment for your joints. And on the topic of simple, foundational things, hydration. Your cartilage, that vital cushion in your knees, is actually made up of a surprisingly large amount of water, around 70 to 80%. When you're well hydrated, Your cartilage is plumper and more resilient, better able to do its job of cushioning and allowing smooth movement. If you're consistently not drinking enough fluids, your cartilage can lose some of its sponginess, potentially making it more susceptible to wear. So, ensuring you're drinking enough water throughout the day is a very simple, practical, and often overlooked tip that contributes to overall joint health. It's a small, gentle act of self-care that your knees will thank you for, and it's something entirely within your control, which can feel quite empowering. Bone health is also intrinsically linked to joint health. Your bones form the underlying structure of your joints. Conditions like osteoporosis, which cause bones to become less dense and more fragile, might not directly cause knee pain in the same way arthritis does, but weaker bones can be more susceptible to fractures even from minor falls, and changes in bone quality around the joint might indirectly influence the joint's integrity over time. Ensuring you have adequate intake of calcium and vitamin D, which is crucial for calcium absorption and bone health, is important throughout life, and especially in later years. Vitamin D also has roles in muscle function and inflammation, so it's a bit of an all-rounder for musculoskeletal well-being. Many people are unaware of their vitamin D levels, and it's something that can be easily checked and supplemented if necessary, under guidance. Let's touch very delicately on the mind-body connection. This is not to say, in any way, that your knee pain is all in your head. The pain you feel is absolutely real. However, our emotional state can influence how we perceive and experience pain. When you're feeling stressed, anxious, or perhaps a bit low in mood, your body's sensitivity to pain can increase. Stress hormones can also contribute to inflammation. Moreover, when you're in persistent pain, it can naturally affect your mood and sleep, which in turn can make the pain feel worse. It can become a bit of a challenging cycle. Gently acknowledging this connection can be helpful. Finding ways to manage stress, whether it's through quiet hobbies, spending time in nature, practicing mindfulness or gentle meditation, or connecting with supportive friends and family, can sometimes have a surprisingly positive effect on how you experience physical discomfort, including knee pain. It's about nurturing your whole self, which invariably helps your body cope better. This is one of those reassuring observations. Even if the physical cause of the pain remains, working on your emotional well-being can change your relationship with the pain, making it feel less overwhelming. Think also about how you sleep. If you often wake up with a particularly stiff or sore knee, your sleeping position might be playing a part. For example, if you sleep on your side with your knees bent and pressed together, it can put strain on the hip and cause the top knee to fall inwards, potentially stressing the knee joint overnight. Similarly, sleeping on your stomach can put your spine in an awkward position, which might indirectly affect your knees. A simple, comforting tip here is to try sleeping on your side with a pillow placed between your knees. This helps to keep your hips, pelvis, and knees in better alignment, reducing stress on the joints. Shish, just let go, peaceful, sleep, deep, comfortable, sleep.